I'm Dr. Bohsali. I'm one of the orthopedic surgeons at the Jacksonville Orthopedic Institute. I work at the Beaches Division, and today we're going to be talking about rotator cuff tears, how you identify them and how you treat them. The common question that I get is, what is the rotator cuff? The rotator cuff consists of 4 specific muscles that are in your shoulder, and those muscles actually enable you to raise your arm and to position your hand in space. And there are a variety of conditions that can cause problems in the rotator cuff, one of them which is called a rotator cuff tear. So how do you know if your rotator cuff is torn? Well, there are a variety of symptoms that can present themselves after you've had a rotator cuff tear, whether that's a traumatic tear or a degenerative tear. And the most common symptoms that present are those related to pain, difficulty raising the arm above head level. Sometimes folks will complain about mechanical issues such as cracking and popping. So what can cause a rotator cuff tear? Well, they're both traumatic conditions such as falls, situations where you're doing sport-specific activities that can generate what we call an acute rotator cuff tear, meaning there's a defined event and then you have problems with the shoulder. And there are also other situations where you can have a degenerative rotator cuff tear, which is a tear that develops over time. And so folks who have that type of tear will typically have symptoms such as pain, motion loss, and weakness that will be present for several months to years before they actually present to one of us. So what happens if you have a documented rotator cuff tear? Well, not all tears require surgery, and at JOI we actually try non-surgical options first, and that involves things such as injections, anti-inflammatory medications, physical therapy, moist heat, and those modalities are typically used first before we have a conversation with you about other treatment options such as surgery. Sometimes surgery is the answer. The type of surgery that's involved to fix these rotator cuff tears is primarily based on what's called an arthroscopic procedure. So it's a procedure that's done with a camera, that's done minimally invasive and done as what we call an outpatient or same-day surgery. Most people who have a rotator cuff tear do require about 4 to 6 months of recovery, and that involves basically a period of immobilization in a sling, physical therapy, and a gradual resumption of your activities to tolerance. So if you believe that you have a rotator cuff tear, we are happy to manage that issue for you. If you call JOI 2000, we will get you in to see one of our top specialists within the organization, including myself. At that point, we can do an evaluation and determine whether you need more testing.